Good afternoon, everyone. Thank you for joining us. We're just waiting for a few more participants to get started. We'll get started shortly. Good afternoon, everyone. Thank you for joining us, commissioners. I'm now turning on the ability to start your video and audio.
All right. Ethan, can you hear me okay?
I can.
Excellent. Well, good afternoon, everybody. We'll get this meeting started. My name is Sean Varner, and I am the Vice Chair of the Little Hoover Commission. I'm standing in for our irreplaceable chairman, Pedro Nava, who can't be with us. I am quite confident everyone misses Pedro at the helm, but at any rate, thank you all for joining us today. I'd like to introduce the other commissioners of the Little Hoover Commission, although none of these esteemed individuals need introduction. Some of them are on the call now, and others may be joining us a little later. I will introduce them all nonetheless. Commissioners Dion Erner, David Byer, Cynthia Buiza, Anthony Canella, Bill Emerson, Gil Garcetti, and Janice Sidley, and the 4 legislative members of our commission, Assemblymember Tasha Borner-Horvath, Assemblymember Philip Chen, Senator David Min, and Senator David Nielsen. I'm sorry, Senator Jim Nielsen, sorry. As I mentioned, Commissioner Chairman Nava is unable to attend today. Also with us today are the Commission's excellent staff, Executive Director Ethan Rarick, Deputy Executive Director Tamar Foster, Project Managers Crystal Beckham and Tristan Stein, and Analysts Sherry McAllister and Ashley Hurley. Thank you all for the great work that you do. As normal in the course of these hearings, and let me do some housekeeping before we turn to the subject. To ensure we are respectful of the disparities of different groups, which are the focus of this study, this hearing will include live Spanish and American Sign Language interpretation to help improve accessibility for consumers in the developmental disabilities system. Please click the interpretation button on the bottom of your Zoom screen to select your preferred language. Commissioners' audio and video will be turned on throughout the duration of this hearing. Commissioners, as you know, and by way of reminder, if you have unruly animals or even children in the background, you may wish to mute yourself when you're not speaking. Please remember to unmute yourself if you want to make a comment and ask a question during the hearing, of course. The video and audio of our hearing will be turned on when it is their turn to speak. Members of the public will be muted during the hearing. We will have a public comment session at the end of the hearing. For those who wish to make a comment during public comment session, we will unmute you in accordance with the queue. If you'd like to make public comment, please use the raise hand feature in Zoom by clicking on the hand icon to join our public comment queue. Before making public comment, please make sure that you have selected your preferred language using the interpretation button at the bottom of the Zoom screen, as we mentioned before, to ensure your comments are heard by the broader audience. Those who have joined us by phone may either dial *9 to raise their hand on Zoom or send an email to littlehoover@lhc.ca.gov indicating you'd like to address the commission. You must provide the phone number from which you have joined the meeting so our staff knows to unmute you. Staff will be monitoring raised hands and emails requesting comment throughout the duration of our hearing. As is usual, commission hearings, public comment is limited to 3 minutes per speaker. If you reach the 3-minute mark, please excuse any buzzers and bells that may ensue to warn you. We are recording today's hearing, and after the hearing, staff will place a permanent link to the recording on our website and upload it to our YouTube channel and Facebook page. Love social media. And now the substance of today's hearing. This is the commission's final hearing on our important study examining California's developmental disabilities system. In the last month, we held 2 events to address concerns regarding the system. At our first hearing 1 month ago, we discussed and heard testimony on what it's like for individuals with intellectual and developmental disabilities and their families to access services and for service providers to participate in the system and some of the challenges that they have faced. 2 weeks ago, we held an advisory committee roundtable that focused on identifying ways in which we can reduce disparities and increase access to services. Now, today's hearing aims to explore how the system is identifying, tracking, and addressing disparities and working to improve access to services. Again, I'd like to thank Commissioners Emerson and Erner for serving on the subcommittee for this study and for their leadership on this crucial topic, both now and in their past service to the state. This hearing was organized by Deputy Executive Director Tamar Foster. Thank you for your great work on this topic. And now I'd like to ask Tamar to take it from here and introduce the first witness.
Thank you so much, Commissioner Gardner. Our first witness today is Nancy Bargmann. Nancy Bargmann has served as Director of the California Department of Developmental Services since 2016. Previously, she served as Deputy Director of the department's Community Service Division. And before joining the department, she held a variety of leadership positions throughout the field of developmental disabilities. Thank you so much for joining us, Director Bargmann. Welcome.
Oh, thank you and good morning. And thank you for the introduction. As noted, I am Nancy Bargmann, Director of the Department of Developmental Services, and I'm very grateful for this opportunity to be before the Commission today on behalf of the leadership and staff at the Department of Developmental Services. We are honored to be entrusted to deliver on the California's promise to stand by individuals with developmental disabilities and their families, and entrusted to be able to support them in their choices, beliefs, values, needs, and goals. Many of the department staff came to the work because of their experiences with their own families or through assisting loved ones who have faced challenges in their lives or within their family. For me, it started in 1984 when I was hired as a direct service professional and met remarkable individuals with developmental disabilities. And within days of meeting them, the course of my career was changed. I am continually humbled by the commitment and passion of our self-advocates, families, staff, and community partners who demonstrate the efforts in supporting individuals with developmental disabilities in California. It is painful to hear the struggles families experience in accessing services. We are carefully listening to the hearings and making sure that we're also listening to our community through our community engagement efforts. Many of the voices are from individuals and families who believe that their economic status, ethnicity, or language pose an additional barrier to obtaining services they need and deserve. This experience is unacceptable. We are committed to directly facing these shortcomings, to objectively examine them, and to take action to address them. To further this effort, I will shortly present to you new action items that we will be implementing. The challenges are real, and the factors that lead to discrepancies in services or access are as complex as the 400,000 individuals that we serve today. If there were quick fixes, we would not be having this conversation, but complexity cannot be another barrier. To meet consumers where they are, we have expanded community engagement that is unprecedented in the history of our department. Outreach and ongoing communication is and must be embedded in all of our work and our work culture.
Ms. Bargmann?
Yes, please.
I apologize for interrupting you, but as Pedro Nava likes to say, that interruption is sometimes the greatest form of flattery in this discussion. I see that Commissioner Sidley has a question for you.
Oh, of course.
So I do, and I'm thrilled to have you here today, and I appreciate your opening remarks and your concern about what is going on. I am candidly new to this topic, but I have now done quite a bit of research, and I'd like to ask a couple questions. Hopefully there's an answer, but I'd like to first fundamentally understand how the 21 regional centers received their franchise. How were they selected? Through an RFP? What is that process?
Oh, thank you, Commissioner. I really appreciate kind of that fundamental and kind of baseline information that's going to be really valuable for the conversation that you all have and with recommendations. So the Lanterman Act over 50 years ago established the framework for which delivery of services. Started off with 3 pilot regional centers, and then later the Lanterman Act noted that there would be 21 regional centers. And I believe one of your other witnesses had testified to kind of that structure. And so within the Lanterman Act demonstrated there would be 21 private nonprofit organizations. And so decades ago, that was established with all 21. They were throughout the state at the time. It was.
I know, no, Nancy, I understand that there are 21. That's not my question. My question is, who picked the people who run them? How was that created? These people are sending out state money, federal money. Is there an RFP? How often are the people who are running them? How often are they selected? Is there a transparent process? Or they were established and they just run by themselves and there's no oversight from the state. That's what I'm trying to understand. How are these people who are running the 21 centers, how are they selected to run those 21 centers?
So, and I apologize for not getting kind of to the point quicker, but the 21 regional centers and the structure of that was established many decades ago, that they were private nonprofit organizations. So, 40 some 50 years ago, those organizations were established and they have continued. There were different times over the years that regional centers may have lost their contract with the state because of corrective action, but largely each of those regional centers have remained as private nonprofit as an organization. And as such, they have a board of directors. There's not a new RFP. We've not established a new process of selecting it. And so each regional center has a responsibility as a private nonprofit organization to have an established board. And then that board does change. There's different bylaws, there's requirements within statute as to the term limits of board members. There's, in the last 10 years, those those changes have occurred. So you do have changes as to kind of structure and deliverable within it, but
So
each
let me ask you-
organization has been there.
Let me ask you a question. You just said, so they have their contract and you indicated that some have lost their contract. How do they lose their contract? What oversight does the state have in order for somebody to lose a contract?
So it's been many years, and there's outlined in the law, in the Lanterman Act, there's various steps that can occur. So the Department of Developmental Services has a contract with each 21 regional centers. That contract is largely the same for all 21 regional centers, have provisions that are outlined in law, and then are provisions within the contract. So in the Lanterman Act, there's the ability, and so DDS does have some general oversight or general kind of authority, if you will, to have assurances that we're holding regional centers accountable to compliance with statute and law. And so when that does not happen, what we do as a department, and over the years, kind of that oversight has changed in the sense of our ability to affect kind of correction. So we start with technical assistance at the lowest level. We can, within the law, can go up to corrective action. We go to a place that we identify as probation per a regional center. And as a reminder, our contract is with the board of directors. And then we could have special contract language. And so you really kind of elevate based on either the seriousness of what is not in compliance, or that there's kind of over time some systemic things that are not getting fixed. And then from the special contract language, failure to comply with that can ultimately lead to termination of the contract with the regional center in the state. And the state could either identify a new board to operate the regional center, or the state of California through the Department of Developmental Services could operate it.
So what would trigger the review? Is it something you see, or is it all these complaints of people that we're hearing testifying here? What triggers the review of the contract?
Well, annually, we do update the contract. So there's new provisions of the contract that are modified on an annual basis, depending on what's occurring. And since, oh gosh, in the last probably 4 to 5 years, I think we've had like 30 new provisions of requirements added to the contract. So DDS does have that responsibility. So we will take a look at what is occurring if there's complaints, if we start seeing that there's consistent or egregious non-compliance with state law. So I'll give you some examples. When we've really noticed that there's items that were identified in the annual or the biannual audit that occurs by DDS, but we also see it based on complaints. One of the things that we've done is that we have increased our oversight because we've established a new division in the department where we have liaison teams that has responsibility for 3 regional centers and monitoring. That gives me the ability to take a look at what is occurring as to the compliance by each of the regional centers. And so, and again, we really do want to be able to provide services to individuals. We want to make sure that regional centers are providing that. So if we can achieve that by technical assistance or training, that is really the lowest level that we want to be at, and make sure that we achieve it, because that's the quickest remedy to any problem. But then if we can't do that, then we will go ahead and identify special contract language, work with the board, have requirements for them to be able to have assurances of compliance. And then if it's so egregious that we need to then go into termination of contract. I will tell you that termination of contract, if we cannot remedy it, it would be the most disruptive to the community, not only the staff, but also to families and consumers. So I really do take it as a serious responsibility of DDS to remedy it as soon as possible to make sure that we get services to individuals.
Okay, so I have 2 other questions, and I'll just ask them, and then I see that I have other commissioners who want to ask questions. I understand the Lanterman Act. I understand that these are private nonprofits. However, they are putting out state and federal money. Why aren't they required to have the same transparency of a government agency, because that's where their funding comes from? And if it's not, would you like to have that oversight of these regional centers? I'd like to know how much people are getting paid. I'd like to audit their money. I'd like to, all of that to be a public disclosure, like it is for any other public agency. Yet it's not. And so I'd like to know your views and how that would help, do you think, to remedy some of these complaints?
Yeah, so to answer the kind of latter question as to what are my views of that, I think transparency is extremely critical. We are using state and federal dollars. The transparency has absolutely increased in the number of years. Even since I've been director, we've increased our transparency for regional centers on a number of fronts. We have the requirements as far as data that has to be posted. We've required regional centers board of directors to be present and have presentations by regional centers on kind of key indicators that they're working on, whether it's a purchase or service expenditures, it could be their community placement plan. There's a number of things that we've really mandated as far as making sure that there's clear and kind of transparent information that's shared. That said, so we also have information regarding each regional center on kind of salary schedules. We have transparency recently that is reporting executive director salaries. You know, we also, I think it's important to the work that we do as a kind of our obligation and fiduciary of state dollars is that we have every other year, we do an annual or every other year review of each regional center's financials. So we take a look at their operations. We also take a look at their compliance with requirements within the law. And then in those instances, when we're starting to see issues of concern that cannot be remedied, we've even changed it from, we've increased that oversight to where we would do annual fiscal reviews. More can certainly be done. And I think that's the opportunity that we all get to be able to evaluate, you know, what is working, what's not working. Lastly, I'd just like to note, Commissioner, is that, you know, data and information is really what stems a lot of that transparency. You know, we've built our transparency based on when we've had data available. I'm looking forward to being able to modernize our IT systems, where not only our case management system, but also our UFAS system is what our acronym is. It's our financial management system. And it is very, very, very old. It's probably over 30 years old. And so as we're building those systems, we're going to have greater transparency, but we're also going to have greater information that's going to be able to inform us so we can make the best decisions and best recommendations on policy.
Well, I hope that you get that system soon, because I mean, all we've heard are complaints, and these are families that are struggling, and these are adults that are struggling and need the support. And as people pointed out, it is an entitlement, and we don't seem to be, as a state, living up even close to what the expectations are. So I'll stop talking. I'm done.
Okay, well,
Thank you for your
so
question.
Mr. Sidley has opened the floodgates on some questions. So we'll, in the queue right now is Commissioner Byer, then Commissioner Erner, and then Commissioner Canella. So Commissioner Byer, you're on.
Sure. Well, thank you, Commissioner Sidley, and thank you to the director. I appreciate the fact that you've been in this sector for 38 years, and we've been in it for not even 38 months. So you all know a lot more about the subject than we do, but I want to take you to a higher altitude question. But I'm going to start with two observations you can disagree with, but I'll get to the question. The observations are, we've learned from witnesses a lot about how other states behave. So put a pin in that question. What can we learn from them? And second, we've learned an immense amount about the long, tragic history of disparities, racial, ethnic disparities. And that latter part, which you said, is unacceptable. So my question is, if you had 2 minutes with the governor, with Governor Newsom, and he said, this is an unacceptable outcome, this disparity problem, and you've been given a long time to fix it. The legislature is really mad about it. And this is the last chance. And you've got 2 minutes to say, what tools do you need to remedy this in a timely fashion? Think of this as something that's not going to go through some kind of budget review in the horseshoe. It's going to be your personal view of what tools you need. And what do I mean by tools? Ability to directly control the regional centers, not be hamstrung by their board of directors or their independents, ability to hire and fire directors, or other tools of that magnitude. So my question is, how do you propose to fix the racial ethnic disparities in the system you operate?
Well, I appreciate the question, and what you don't know about me, I'm also somebody who is very thoughtful. It's not a simple question, and it's an important question. When we take a look at, so I'm going to start with your first question regarding comparing other states. I always look to my counterparts in other states to see what is it they're doing that is affecting positive change. Example, highly complex needs. You know, we have a serious challenge before us. We have individuals with really complex needs that finding the appropriate services and supports to do that work, it's been a significant struggle. This is a struggle that is not only in California, but certainly across the nation. And we've done a lot of progress in that area, but I will tell you that we still are not meeting that need. So I work with my counterparts. Service access and equity, I know it is not acceptable, and I don't want to say that what I'm going to share with you right now is an excuse, because I think it's just something that to raise awareness. The work that California has done, and the work that the legislature has supported, and the work that our community-based organizations and regional centers have done, I will tell you, it is nationally one of the best things that has occurred in any state.
So why does California have one of the worst levels of employment by people served?
Well, if I could change one thing, well, actually, I'll have a laundry list of things I want to change, but we are working on a lot of those areas. Employment.
Well, working isn't a solution. I'm trying to focus on things that you're going to propose, not your feelings, not your progress. Things that are broken, just say they're broken, and these are the 3 things we're going to do. That's all we're looking for. We want to help you.
Oh, Commissioner, I understand you do, but I also want to make sure that we are starting at the same place. So when we compare, and I heard the testimony about comparing California unemployment to other states, you know, it's not apples to apples. And the reason why I want to say this is because I agree, employment and finding employment for individuals has to occur. And it is a priority of the department. I'll tell you the things that we're doing to be able to remedy that. And I'm very committed to that. But I'm also very concerned if we're taking a look and comparing ourselves to other states when it's not apples to apples. Right. California is an entitlement. And we serve anybody who is eligible for services in California's law. Other states, when they're looking at data, they're looking at those individuals that are receiving services under their federal waiver. They don't include all individuals who are receiving services. So when you look at California, our base of who you're comparing and the percentage of those individuals with employment is very different than when you're looking at another state, because now you're looking at individuals, a kind of a smaller cohort, if you will, as to what that percentage is. It doesn't mean that we shouldn't double and triple down on employment. So right now, our performance measures for regional centers, we have the ability to increase rates. We're going to be implementing a complete rate reform by 24-25. A portion of that is a quality incentive program where providers can get incentives as well as regional centers. One of the performance measures is on employment. We've doubled the incentives for service providers who are able to help an individual seek competitive employment. We've also have an incentive for providers if they're able to increase their workforce capacity on expertise on employment. We've also included a satisfaction element of it to make sure that individuals in those experiences are in jobs that they like and that they've chosen. We have $10 million that we're using right now, as well as Department of Rehab They have $10 million to be able to increase kind of the work that employers are doing and the work that we're doing. We are very laser focused on it because the numbers of individuals with employment is not acceptable and we need to increase it.
Well, let me just make a request that after the hearing, if you could work with staff to provide the 3 states you think have a comparable population and 3 things they do that California doesn't do on employment that we should do.
I will make a commitment to work with staff. I would like to do that. I will, however, flag for you that there's not another state in the nation that has comparable population, but I will say that there are states that have really great initiatives on employment, and I think that's an important conversation.
Commissioner
Okay,
Erna.
could you turn to the disparity question, please? So
On
you're sitting with the governor. What are the things that you want as tools to fix this problem? It's a longstanding problem. When the legislature's called out, there's been previous reform efforts. None of them have worked. What are you proposing?
Well, and I'm going to answer the question in just a different way, because I do believe that many of the efforts that the legislature and the administration has prioritized are having positive impacts. You know, the current experiences, I agree, are not acceptable, but the investments and the initiatives, we have significant initiatives that are addressing the service access and equity that really, I also need time and space to implement these really great things. We have right now about 40 new initiatives implementing those. One, for example, is that we, in this last year's budget, we have a coordinated family support model that is really designed to support individuals who are living at home, they're adults, and primarily targeted for those multi-generational families, and primarily those that where families, you know, kind of keep their supports within the family. We know that individuals who are from communities of color have lower purchase of service that are living at home with families that are adults. So how do we help make sure that we're helping those families be able to access those services? I am extremely proud of the initiatives that we have put forward in the last couple of years. I do believe that we have more work to do to implement them in a timely basis. And we have to remember, I will say this every day of the week, you know, this is not an event. This is something that we have to continue to evaluate and continue to make sure that we're responding to our community, hearing from them as to what will work and what doesn't work. So I apologize that I'm not giving you exactly what you're asking for, but
your answer is you don't need any tools. You don't need any more supervision of the regional centers or the ability to hire or fire the directors of the regional centers. Is that a fair summary?
That is not a fair summary. I apologize. It is not.
I'm
saying that
Which do you want? Do you want the ability to directly supervise the centers, hire and fire the directors? Yes or no?
I believe that I do not. I believe that right now we have a system that is been established to have a nonprofit organization that can work directly with their communities and kind of build those services. I do believe that we have things that I can do that can help kind of support their efforts and to increase some accountability and oversight, but I do not believe that the state should go ahead and operate the regional centers. I understand that recommendations may come from this work. I look forward to working with the commission to explore, well, what are those options that we can improve to make sure that we are meeting the intent of the Lanterman Act of serving the people in California with disabilities.
Thank you.
Thank you.
Okay, Commissioner Erna.
Thank you. Good morning, Nance. How are you?
Good morning. Good to see you, Commissioner.
Good. It's good to see you too. And thanks for coming forward and testifying. So let's try to clarify a few things. I'm going to actually try to help you out a little bit. All right. So first of all, for the other commissioners, the state has gone in and taken over regional centers in the past. Usually it's around fiscal issues, to be honest with you. At least that's what I remember. But it could be around programmatic issues. And when I say that the state goes in and takes over, I don't mean that the state replaces 500 employees at a regional center, but they will go over and take over management, for example, all right? And then hopefully be able to take that regional center through a corrective action plan so that they can get back on their feet. They also can go in and actually say to the board, do we want you to change the whole board? And they've done that in the past, where where they've actually initiated an action where the board has to turn over completely because the state has lost confidence in that particular board. All right. In regards to this idea of Commissioner Byer, where I hear you going, you know, when the act was first passed, I'm sure there were discussions regarding, do we want to have the state of California run program, run eligibility and all of those kinds of things. My presumption is, because I wasn't around then, I mean, I was in the community, but I wasn't around then. But my presumption is that one of the conversations was if they become state employees, the cost of the system goes up dramatically. And so this is, you know, this is analogous to the world I live in right now in childcare, where then Governor Jerry Brown did not want to take on state employees to run the childcare systems, right? That kind of thing. It's the same thing here. I don't think the commission wants to go down the road of saying maybe we should change the complete design of the system because there are issues within the regional center system. I don't think that's going to fly, so I don't think we should waste our time. I think the real issue is how do we standardize? How do we standardize program? How do we ensure that every consumer has access to the same range of services that every other consumer, no matter their geography, no matter their ethnic or cultural backgrounds, that kind of thing. That's where we have some real issues at this point. And then, you know, while Nancy doesn't say it because she's not authorized to say it, money is an issue here. All right, that even though we have around $12 billion going into the system, which is a dramatic increase over the years, right? Because the number of people being identified continues to go up, right? The caseload, the overall caseload grows by sometimes 10,000 consumers a year, sometimes a little bit more. But the revenue that comes in to take care of those never matches what the actual need is. And as Director Bargmann has said, the complexity of the consumers that we are now serving has grown significantly, right? And part of that's because of the medical history in this state and across the country, if not the world. The number of children that are born with severe disabilities who maybe 40 years ago would not have been born, all right, but are born today. And we can meet their needs very often in a way that gives them a quality of life that we never dreamed of before. And so, but the issue that there is an issue of money, straight up, and whether or not the investment that we are making is significant enough to be able to enable as many consumers to be able to live a full life. And then the last thing I want to talk about is the employment issue, because it's really hard to compare California to the rest of the country. And that is because, first of all, we have a regional center system. I don't know if any other state ever developed a regional center system. I don't think so, but I might be wrong. Nancy can correct me if I'm wrong. But the definitions of employment can be very different. It can be very different from regional center to regional center, but most importantly from state to state, because some people in their counts include clients that work in workshops. Well, some of us don't agree that being in a workshop it really fulfills the employment definition, right? When I talk about employment, I mean somebody getting paid a real salary in a nonprofit or a business setting, right, in the community. I don't mean sitting in a workshop from 9 to 5 and doing whatever is happening in that workshop. That to me is not that's not an employment definition. And I think other states probably still use workshop numbers in their definitions of who's working and who's employed. So we need to be careful about as we compare ourselves, right? And now I do want to ask a question, because Nancy, the IT issue is huge. You and I lived through the last debacle, right, where I think $40 million was spent for nothing, and we all kind of gave up. And so why don't you talk a little bit about what you're thinking about, because data, right, collecting data by hand is not an easy thing to do anymore. And so what do you see happening in the IT world this time? Are we going to learn from our last mistakes, because they were huge? The end user was not happy, remember, and neither was management, the regional centers, neither was the department or the administration. Yeah. So what are you thinking about for IT this time?
Yeah, and lessons learned, is definitely part of what lessons learned from the last kind of attempt to modernize an IT system. But also using some of the lessons learned that some regional centers have already implemented in new IT systems. We may have a number of different systems that each regional center has kind of organically grown. we do have some really great examples of things that they've been able to kind of build. You know, what are the elements? What's helpful for service coordinators? What is able to kind of capture the data that we're wanting to realize across the state? It could be the employment data. It could be in the IPP, how many people have in their IPP that they want a paid job that is a living wage, you know, so we can start tracking, you know, the outcomes of those. We also are engaging our stakeholders. So that's where we are right now. So we have approval to do two things. One is an electronic record system for case coordination. But when we propose this is really about not only an inward facing source that is available to service coordinators, but available to the state and others to be able to track information and real-time data, which is going to be incredible, but also outward facing. So we want to make sure that this is also available to self-advocates and family members where they can access their information, their individual program plan, they can schedule appointments, they can have access to the information of every single service provider. We really do want to be able to have families be able to, because one of the things that you hear, and I believe I heard it during one of the testimonies, is they don't know what services are available. So, and they don't have access to that. So it's like listening to all of the concerns and how do we build that into a remedy in this system. And I do believe that we're going to be able to do it. It may take time, but they could go ahead and plug in their zip code. And I have a child with autism that is X number of years old that, you know, speak Spanish, and then start receiving, well, here are the resources that are available. So I have really important visions to be able to have this to be a remedy and an access for families as well.
So what's the time? But what's the time? Are we talking about 10 years?
It's going to be, you know, we're working on that timeline right now, Commissioner. And, but we're not going to see it in the next couple of years. I will be honest with you. It is going to take time to build it, and it may come in increments, but we're also not waiting. You know, we've been increasing the number of data elements within our existing resources. So the other part that we need to do is clean up our data. So even with our existing data, to be able to have the new system be able to do the work that we intend it to do. For example, and I believe in the testimony, when we take a look at by ethnicity of our population, we identify kind of those different kind of ethnic kind of categories, if you will, many years ago. We need to update that. We have within our tracking, regional centers has a category that they can code somebody as other category and ethnicity. Well, that category, I will tell you, has increased so much. So I can't tell based on etnicity. So service access and equity, I believe many individuals who may identify as Black or African American, they may be in this other category. So I'm losing data to understand what is that service for those individuals. So we need to clean that up and have regional centers, you know, make sure that they're working with families to have reliable and valid data. So those are the things that we're doing to kind of build up to it. I'm excited about it. I'm saddened that it takes so long to build an IT system, but it's going to take us a while.
Okay, and then let's talk about this standardization issue a little bit, all right? Because it's been bothersome to me for years, right, to say the least, okay? And I guess there appears to be some differences of opinion as to how much control the Department of Developmental Services can have over regional centers, which I don't quite understand, to be honest with you, because they're wholly owned subsidiaries of the state of California. They were created by the state. And so I'm really interested in what can we do around standardization? Does it take legislation at this point to get some standardization, or can the department do it through regs, that kind of thing? Because something's got to change here, because as you know, you've listened to so many consumers over the years. Even within a regional center, there's no standardization half of the time. But between regional centers, because boards of directors could for so long decide on what services they wanted to provide, for example, right? And so, you know, some of them said we don't want to do respite, so they didn't do respite. Somebody else said they want to do with something else. And obviously in the self-directed, I mean, the whole conversation around self-directed is the prime example there, right? Of somebody wants to do it, so they do it, but the others don't do it. when the legislature has spoken and and the governor has spoken, right? Governor has signed the bills to say, let's go in this direction. And so I'm really trying to figure out, what are the stumbling blocks to standardization that you see?
I do think that the remedy is going to be multiple approaches. There may be areas that has to be in statute. We are also, I have already identified areas in which we can standardize and implemented some of those efforts. We're working with ARCA as well. And some of the things that I wanted to kind of share with you today is that we're working with ARCA to standardize the vendorization process. This is a real problem across California right now. You know, you take a look at 21 different ways that service providers need to become vendored. Another example of that is that participant-directed services. This may not be kind of familiar to everybody, but it is a way for individuals to self-direct. It's a really great option for families to be able to kind of manage a particular service, as example, respite, hiring somebody on their own. But when you take a look at the vendorization process, if one regional center has a simplified version, that is helpful, but another regional center has not done that, and it's 30 pages long, you can imagine how difficult that is for a family member to fill out a kind of very bureaucratic vendorization packet, and that's a barrier. So we're working with ARCA to standardize vendorization process with the regional centers across the state. I believe we can do that without legislation because everybody has said that we can do this. The other is one of the biggest barriers is intake and assessment. You know, regional centers have 21 different ways of having applications for intake and some of the processes. So this is an area that is part of our performance measures, but it's also something that I've asked regional centers to work with us on. They're in agreement. They're going to work with us on standardizing the assessment tool, or not the assessment tool. Well, for early start, we will, but for intake for applications. So if a family member is going from one regional center to another, you know, if they change midstream, that's very difficult for them. So how do we remove that barrier? That's the benefit of standardizing certain practices, is that we then remove the barrier, take the responsibility off the family so we can help them be able to access those services. So those are the things that we're doing right now. We've included some things in the contract. And as we continue to do this work, I'm going to start doing town halls across the state this year and listening to families about what are those barriers or those challenges in accessing services. So I do believe that we're going to get what I call low-hanging fruit. I think they're out there. I think there's things that we can remove. We have lots of things that we've done over the years that we've never taken a step back to ask the question, why are we doing that? You know, so if it doesn't add benefit and it's a barrier, I really want to start removing those.
All right, because I mean, the question for the commission is, I mean, we've heard testimony regarding, you know, this whole idea of using generic services and the steps that families have to go through, right? Literally getting a denial, and then a case manager doesn't even believe that and says, I'm sorry, you need to go back and appeal it, right? This is craziness, everybody. We demand that of families at this point. Why aren't case managers helping them do that? And why can't we cross, particularly like with Medi-Cal, right? Why isn't the application put in at the same time as they're applying for regional center, right? I mean, you know, it's those kinds of things that because of technology now, right, we should be able to do, right? They could apply for a variety of services all at one time, right? You know, but a case manager has to be on board to be able to do that and understand what their roles are and what their capacity is as a case manager.
Yeah, and recognizing kind of that challenge, and that was part of our proposal last year for reducing caseload ratios for birth through age 5. You know, getting it down to 1 to 40 to be able to do that hands-on help. Let's make sure that we're helping. But to your point, I think that data exchange through California Health and Human Services at the agency, you know, how do we share within our sister departments, you know, so we can take away that burden of a family having to kind of get that denial. There's got to be better ways with current systems, right? So those are the things that certainly challenge us to take a look at some recommendations. I think that's really appropriate. Gosh, you know, we'd love to be able to help identify that with you. You know, there's definitely some of the things. One of the areas that we worked with Early Start, we had changed the statute in Early Start to where regional centers then had the authority to provide services prior to receiving denials. So we can take a look at other practices that we've implemented recently to be able to remove some of that barrier and see if there's a broader benefit that we can look at to use for the broader community too.
Great, thanks.
Okay, Commissioner Kennelly, you're next on deck, but I just real quickly, I know Commissioner Emerson, who's on the phone, is on the line here. I just wanted to ensure that he didn't have any comments that he wanted to be in the queue. So,
yes, I do want to be with you. Thank you.
okay, I'll put you in the queue. All right, Commissioner Cannella.
Yeah, thank you. Thank you, Director. Good afternoon. Appreciate you being here. This has been an interesting subject that I didn't know much about either, so I'm learning. I do have a question on the budget. I think a lot of the problems are probably related to budgetary issues. And how does the budget work? Does the money originate in your department and then go to the regional centers? And then if so, why is there such a disparity? For example, I live in the Central Valley, and you guys use the term purchase of service is $18,000 roughly per consumer, but in the Redwood Coast, it's $38,000 per consumer. And I understand there's a lot less consumers there, but how does that get determined? What is going to go to each regional center? And then how does it get changed if it's, because one regional center shouldn't have twice the amount of money of another one, I would assume. So love to get your perspective on that.
No, thank you. And I'm going to give you quite a bit of detail, but I'm going to really try to minimize it because it's not like everything else. It's a pretty complex answer to an important question. So to start with, there's two budgets that regional centers have. They have a purchase of service that goes to the services and supports for individuals, and then operations. And so that's what goes to operations for the administrative and service coordination at the regional center. So what we do is when we're doing our budget, we do have both. We have operations and we have purchase of service. We develop our annual budget based on trends. So we use the information that is informing us as to where we're seeing the trends. If there's what is the last 2 years as an example of services for respite. What is that growth trend? Is that growth trend at 10%, 20%? And so we go ahead and look at that. The allocation then is based on caseload. And so we've really tried to refine it over the years. The reason, and I'm taking a risk of oversimplifying between Redwood Coast and Central Valley. Redwood Coast Regional Center they have comparatively to Central Valley, they have less residential settings that may have increased, have like economies of scale of maybe 4 individuals in a home. Redwood Coast largely will depend on supported living because of the geographic distance. They really don't have a concentrated locations such as Fresno or Bakersfield. And so you'll see that some of the regional centers, the larger regional centers, will have variety different of resources, and different factors kind of play into it. While we still do allocate based on caseload and some of the expenditures, I think you're looking at the expenditures as opposed to what's allocated. They're not terribly different, but those are just some of the differences that you'll see. One of the areas that's important, because one of the examples that's been given is when you take a look at West Side compared to Harbor, or West Side as compared to South Central LA. And I've used the example of South Central LA and West Side Regional Center, particularly when we proposed and looked at rate adjustments. So we did a rate study in 2019. Our rate structure was very archaic. It was piecemealed. And it really presented the risk, and it happened, of one regional center having higher rates than another regional center. That created a lot of disparities within our system over the years, and it magnified because it happened for years. And so the rate models and the rate implementation in 24-25 is intended to address that inequity across geographic areas. So what we're doing is that we're going to be able to now have providers have kind of established rates that's based on the same methodology. There are factors, there's like some modifiers for geographic area, modifiers for some other things, but generally speaking, you're going to see that we're able to do that, which is going to be hugely helpful to increase service providers in some areas and really kind of level that out. It's not going to take away all disparities. We're going to have to still do other things, but you are going to see some significant changes as a result.
So will you need a higher budget allocation to do that? I mean, because if you're gonna give other regional centers more money, I'm assuming you have to take away from the ones that have the higher allocation. How will that work?
Well, it's actually not at the regional center level, it's at the provider level. And so the budget, when we have approval for our rate model, our rate adjustment reform, so it's a $2 billion investment. And so we already have gone through kind of the budget process and the projections, kind of that projection for multi-year has been identified. And so we will be doing that. And then last year's legislative action, we had projected implementation 25-26. Legislative action took it to 24-25. And there's a hold harmless for providers for 2 years. So, you know, we're going to be able, because there's some providers that will receive a decrease at some point based on, because on the rate model that their rates would have been higher than what would have been, say, for another provider. So, but there's a hold harmless for 2 years before kind of those adjustments would be applied.
Thank you.
You're welcome.
Commissioner Sin, I'm going to slip Commissioner Emerson in here at this juncture. That's all right with you.
Yes.
Oh, all right. Thank you. Director Bargmann, thank you for providing our commission with the 2021 regional center budget allocations. I think you've answered some of my questions, but I do have several questions. The first one I would like to ask, that the two largest regional centers, Inland Regional Center and San Diego Regional Center, are both ranked 20 and 21st in the purchase of service per consumer. These two regional centers are pretty mirror each other in terms of the number of consumers, and I want to know why, and does that translate into fewer services for the consumers?
So again, I think stemming from some of the things I shared, and Commissioner, thank you for, you know, certainly San Diego and San Bernardino, Riverside counties. And when you look at the allocation, when I'm trying to think what year it was, I'd have to probably get back to you. I think it was like 2005, 2006, when we, or actually, I apologize, 2008, 2009, when many of the rate freezes and median rates were established. So the regional centers really were kind of then at that point, kind of stagnant at their rates. That had an impact. You'll see that some policy decisions over the years, I also believe have an impact. I don't want to speak for Inland Regional Center, but I think my observation over the years has been that early on Inland had lower participation, say, in supported living services. In supported living services, if you look at our trends, that is one of our fastest growing living options for adults, and is also one of the largest increase in average cost per consumer. And so when Inland had rates set and they were then frozen with some of those rates that didn't get modified, you know, so you do then have, because especially for a regional center, and I'm making some assumptions, and so, but when you have a regional center as large as Inland, you know, and so by volume, their average expenditure then is going to be lower than that of a regional center that has less individuals and may have had a policy that was a higher rate. So there's a lot of factors, honestly, that kind of go into that. I wouldn't assume that it means that they have less services, but I think it is an area that always warrants exploration to understand why one regional center's either expenditures. I also look at participation of number of consumers as an indicator. So we have to look at a number of indicators with each regional center to be able to help inform kind of a conclusion or understanding. So I hope that kind of touches a little bit on your question.
Well, I'm concerned. I mean, the economy between San Diego and the inland Southern California region is vastly different. And yet San Diego has the absolute lowest purchase of service per consumer of the 21 regional centers. And that just does not make sense to me. And I would appreciate you getting back to us on that issue as well. I do have another comment that I want to make. There are two adjacent regional centers in the Los Angeles area, and that is Harbor Regional Center and West Side Regional Centers. They have a purchase of service per consumer difference of $18,000. That translates into one person on one side of the street receiving 65% more in services than the person on the other side of the street. This disparity is just unacceptable, and I think this is something that we need to get to the bottom of. And I don't know if you have a comment about those two regional centers or not.
Yeah, thank you. And one of the areas that we want to make sure that when we're looking at the data, and the purchase of service is a really great indicator of looking deeper into the drivers. We also look at it based on, I think most know that we also break it down based on ethnicity. We also break it down based on age, and we can drill into that for you and get back to you with some additional information. So, and I don't know this to be true between the two regional centers, but some regional centers catchment area has younger children, and they still have purchase of service, but you'll see that largely the services are provided through the school districts, or you'll see a change when ABA services, applied behavioral, so the intervention, the behavioral health treatment services for individuals with autism, a number of years ago that moved over to managed care. That also had an impact on average spending by regional center, because regional centers no longer had the, now it became a generic resource. So we have to also look at it by ages, because if you have a regional center that has a younger population, that has an impact on the overall spend. And then also practices, like I said, you know, was there practice in supported living services? But all worth drilling into and assessing to identify if it's a deeper issue that really requires intervention.
Okay, thank you. I would appreciate continuing that conversation. I have two more questions. Why are there still less than 2,000 individuals in the self-determination program when in 2021 we were supposed to hit the 2,500 mark? Do you think that the regional centers are able to implement SDP, or is there a conflict in the way that they do business now?
Well, I'm happy to tell you we're over 2,000, but your message is still the same, and I don't disagree as far as what's the opportunity to make sure that we're increasing those opportunities for individuals to be able to be part of self-determination. We are increasing, happy to say, since we went statewide in July, we're increasing on an average of 100 more individuals per month. So we are able to kind of maximize those opportunities. We do have, I want to be a little cautious. We are removing a lot of barriers. We've been doing a lot of directives to be able to clarify, to be able to open that door broader. There's some things that I want to be very careful about those, because we do have some infrastructure issues that we're finding that within our IT systems. So for example, our financial system, we didn't realize the limitations that it had until we went statewide. So I guess for example, on the statewide for our financial management system, which is, you know, for our services, the regional centers really are dependent on that to be able to pay financial management services through our FMS, the fiduciaries. we have our FMS providers who now are capping the number of individuals that they'll provide services for. So these are areas that we are actively working on fixing on a short term to be able to open it. So even with the increase in numbers, I do believe that we're going to see another significant increase once we fix the structure issue that we've identified that is kind of challenging our FMS providers, who without an FMS provider a consumer cannot advance in self-determination.
All right, thank you. I have one final question. Do you have any recommendations for the commission to consider regarding DDS's ability to hold regional centers accountable?
Not at this moment, but I'd be more than happy to take a look at the things that we've been exploring on increasing kind of the oversight. It's not just about holding accountable but to be able to affect those changes. You know, when we take a look at our directive authority, we're exploring, you know, what are those opportunities. I want to be able to be cautious and overreaching, but I do think that there's some experiences that we had during the pandemic that was very helpful. You know, we've had lessons learned that, you know, now when I'm putting a policy in place, we do explore what is our directive authority versus regulations. So there's some things around that we may be able to have conversations, but I'm happy to give some thought to that and work with staff.
Okay, we may have some additional written questions that the commission will provide to you based on our hearing today. So with that, I'll turn back. Thank you very much for your participation. Appreciate it.
No, thank you. I appreciate the opportunity.
Great. Commissioner Sidley, then Commissioner Buiza.
I just want to clarify, because I don't think that Commissioner Aaroner actually summarized my questions. I'm not asking for the state to take over the regional centers and replace all those employees with government employees. I am asking for the state to have oversight. I'm asking for the ability to put an auditor in the regional centers. I am asking for the ability to look at the books, look at the records. We have billions of dollars going into these programs, and all we're hearing is that people are not getting services. So how do we learn that? And that is by oversight, that is by audits, that is by holding people to their contracts. And that is what I am talking about. I'm not talking about taking these service centers over. I think that we have to, as you've said, standardize services. I think people need to know what's available. I think we need to make it clear. Yes, there are limitations to the amount of money that is available, but is there a baseline? If somebody walks in and they have a case manager, is that case manager there to help them through the whole system, or is the case manager limited to what they do? I think that many of the families that are coming in, often a single parent family, because they are struggling with this child and because of the situation of the disability, that families have become divorced, and you have a single parent there who's trying to get a job done and take care of the individual and also take care of maybe other children. If they walk into a regional center and they hear case manager, they would think that maybe that person would be there to help them entirely. And that doesn't seem to be clear. So what I am advocating for, and what my point was, is that there needs to be more oversight so that we don't have all of these consumers coming here and saying they are getting no services, they can't get through, they need to file an appeal. And that's just more paperwork, takes more people to read the paper, to read the appeal, versus providing the service. Or here's a brochure of services, what is available, how can we do this? So that is my point, not for the state to take over and run this, but to have accountability and oversight to make sure that the regional centers are providing the service that they are supposed to be providing. So that's it. I will go on mute. Thank you.
Yeah, and no, appreciate that. And if I'd like to just kind of add, and we don't disagree that having the oversight and having kind of those expectations, and that's why many of the initiatives that we put forward, we do have auditors in the regional centers. We have monitors. So we do the fiscal audits. We do the program audits. We have the monitors for each of the different kind of respective areas. There's a laundry list of things that we do as far as monitoring. And that is something we do have a dashboard. We do report out kind of the outcomes of those things. When we look at what can we do else as far as meeting those needs, we've established, because I've heard the concerns from families. This is not the first time that we've heard the concerns. And as I said, it saddens me. It's not okay. And so that's why we've been able to put forward initiatives in the recent years that really do affect a lot of these changes. And I think these are really important things that we're doing. And, in regional centers, I used to be a service coordinator. I went because I want to help people. I want to be able to make sure that we're supporting individuals. And, we also want to make sure that regional centers are delivering on the promise of the Lanterman Act. And you're going to hear from a couple of directors today. I also believe that us moving from not only a compliance-based system of kind of checking to say, are we kind of meeting these boxes, but what's the outcome? What is the experience of individual we're serving? And so that's what we're doing also with our quality incentive program and our performance measures, that it really is, we're getting into a space, it's exciting to be able to say that we're going to be able to reach out to families on an individual basis. What's your experience? We're going to be able to do some real-time kind of experience. I put forward, we're going to have a standard information packet that we started a couple years ago that every single family will have access to. Everyone's going to have the same information about what is a regional center, what are your rights, what's available. It's going to be an early start. It's going to be a Letterman services. So there's many of those initiatives that we're putting forward. And I look forward to the recommendations of how we can improve on some of those areas. So thank you for that. I appreciate the clarity and happy to work with the commission on the things that we're doing.
Commissioner Buiza.
Yes, so I'll be quick because I know we have other speakers. I only wanted to ask Nancy if it's already under your consideration, the model that the California Department of Services are using called California Wraparound. We work with them closely in my day job, and we found that it is one of the approaches that they've found to be very effective because it's very consumer and client focused. It's community-based, so your regional centers have more autonomy. And they, in terms of the issue you raised around employment, they actually have a work group called the California Wraparound Workforce Development, which is solely looking at benchmarks on employment, retention, training. I'm just lifting it up here because we're talking about recommendations and other issues around oversight. It might be a good idea to look at what CDSS is doing on the wraparound services issue.
I think it's a great idea. Always helpful to take a look at other systems that work well. And there's a couple of things that we were able to do. We have navigators that are within the family resource centers. That's new, adding some additional specialized positions at regional centers. But I do love the idea of taking a look at not only, when we talk about other states, what they're doing well within developmental services, but there's times we can learn a lot from practices from other systems. So I will reach out to our sister department to get information and see how that may be some ideas that we should explore. So thank you.
Director, I have a couple questions for you. One, in research on our background materials, it indicated that from 2016 forward, $11 million was received in grants to reduce disparities, but the disparities have become worse. What happened? How were those funds utilized, and do you have any insights on that?
Yeah, thank you. So the $11 million, and this year, the legislature approved us to increase it to 22 for 1 year. So next year will be 11 million again. The first year in 2016, we had the funds where regional centers were able to apply for to use it towards reducing disparities. When we say that disparities have increased, I just want to caution us a little bit, because when we take a look at if it's only based on purchase of service, we really have to take a look at disparities, because as an example, and I'm not saying there's still not disparities, but within respite services, respite is one of those services that communities use primarily, to support, families with individuals at home. So by ethnicity, actually, we have seen that change significantly. So when you look at today's data by consumer within individuals who are white, as compared to those who are Latino or African American, the average spend is actually greater for communities of color than they are for whites. When you take a look on the aggregate, our costs on an average spend, you're now looking at then the cost of, say, out of home residential services, which is a higher cost service. It was much higher cost. But that's why we did the coordinated family supports in the family home, because families of from particularly the Hispanic community said, wait, our culture is about supporting each other. So now they have a family member at home that, how do we help support them? Why does somebody get more money if they move out of home when we want to support? So we didn't disagree. So we're designing a whole new model to support families who make those choices, to make sure that they have those supports to be successful and receive the lifelong supports in the family home. So that those dollars have not been factored into that aggregate data. So I also just want to make sure that we look at the experience of individuals. My example of respite, if we surveyed, I may still see that there's a disparity within respite, because we may not have respite providers who speak the family's preferred language. So while they may be spending more money, they may not have somebody who speaks Spanish or Tagalog in the home. So we want to make sure that we're also measuring the experience of individuals. The community-based organizations that we have today, that we get to share best practices. Last year, we heard from a family who was from the tribal community. They came in and said, we are not getting early start services. And when I looked at the data, they were absolutely right. They were sorely underrepresented as far as being able to get early start services. So we've been working together to make sure those numbers are changing. So as we are looking at affecting change, we have to look at a broader kind of definition on disparity. We still have disparity, and we still have to make this an everyday discussion as to how we really break those barriers. Georgetown University, we contracted with them to evaluate our $11 million program to see what are their recommendations to enhance it, to make sure that we really are affecting change. Are we measuring the right outcomes? Are we not measuring the right outcomes? That report will be released in March, and we really look forward to making sure that we're using the $11 million in a way that really does support and affects change to get access to those communities that are underserved and really kind of deserve those benefits of the funding.
Thank you. Just one follow-up question on that, on the use of those funds and looking at some of the disparities. I note that the 21 regional centers were based on population of trying to address a population of 1 million. And since that time, obviously, there's been a growth in that community, maybe double. Has there been any thought about expanding the number of regional centers, if that's the right vehicle for developmentally disabled folks? And then also with that is the region, some of those regions, like obviously San Bernardino, Riverside counties, that's a huge region. And so how do you service that region and ensure that there's access to the system?
Right. And I'll tell you, over the years, I know there's been different attempts of really evaluating, what is the kind of best approach to address the kind of changes of population in different geographic areas. And it's been, again, kind of a complex question as to how do you do that? I'm open to kind of any discussion. I'm not particularly looking that more regional centers is better. When you take a look at other systems that have a number of other kind of local assistance, More may mean more complications. It may not standardize. You may not get to a standardization. So we really have to take a look at, how do we kind of manage the complexity with, if we had 42 regional centers, or if we had 30 regional centers, we may be kind of experiencing some of those things. I do think, though, to be able to address the issues of kind of the growth areas is to really evaluate, where do we have staff and offices? Are they still within the community where people are living? So, again, as Inland Regional Center is very large, San Bernardino, Riverside County. Are there staff that are able to be present in the community to meet individuals where they are? And those are the things that we can do. But right now, I think that going to larger numbers doesn't necessarily kind of fix the issue if we don't fix the systemic issues in our present structure.
Fair enough. Thank you. Senator Nielsen. You're on mute, Senator Nielsen.
Senator, you're still muted on your end. There you are.
There we go. Ms. Bargmann, this kind of gets back to earlier conversations here today, and it relates to oversight. A lot of things here we've discussed does relate to oversight. Madam Director, who do you look at as oversight of your department? Would it be ledger analysts, Department of Finance, the governor, the legislature, the budget committee, oversight hearings? Who is your oversight? Do you have an inspector general? Probably not, but who do you see as your oversight?
Well, we have a number. So certainly legislature, we report within the administration. We do have OIG that, because we had federal dollars, so you have kind of that federal oversight. There's a lot of areas in which there's responsibility that DDS, that we as a state department, not only based on funding, but based on statute, that we have kind of that oversight and that we're accountable to, but we're also accountable to the people we serve. So there's those kind of intersections. We have to make sure that we're meeting the obligations within the law, but we also want to make sure that we're meeting the needs and services of those that we have the responsibility for.
Well, that's one of our deficiencies throughout government, and the staff that I have enjoyed over the decades, that's mostly what they deal with. Constituents who are not getting well served or assisted by XYZ agency. Now, oversight has been a deficiency for a long time. To the credit of the state Senate, and Senator Cannella, Emerson, and I got to enjoy this, where the Senate was exerting more of its own oversight, mostly through the Budget Committee, but also through policy committees as well. I have found how very needed that is, which gets me to an overriding issue, and probably the one I want to focus on, because earlier we talked about IT. This is the biggest mess in California government, our deficient IT system, the billions and billions and billions of dollars we have spent on IT upgrades that have not worked. Almost every one has been a failure. The most recent is Fiscal. And I just don't see how we can tolerate that anymore. And then we hear people say, well, it'll be a lot better if we do this or if we do that. And this is going to come online and it's going to cost XYZ dollars. We've talked about that here this very day. But without strong oversight and without consequences for failure, either the provider failure or the agency's failure, or the legislature's failure too, that's a bigger issue, then nothing gets better. It just grinds around and we talk about it inexhaustibly. We spend billions of dollars. Whenever we talk about solving problems as we are here today, and we start talking about IT being the answer, I don't buy it. because I do not see us in the state of California being capable of getting any of these IT programs right. Have you seen successes with IT that you have employed and deployed within your agency?
Needed the IT. So I have seen success that even at some of the regional center levels that they've done some really great kind of system, and we are all connected. As far as an entire IT system overhaul, we haven't had that. I do like the plan. I do see that the plan that our IT team is and working within kind of our state system is very thoughtful. We are using outside consultants, but I've not had that experience of implementing a comprehensive modification to an IT system. I will tell you, it's needed. I don't want to wait to make changes within our system on improving access to services or monitoring or oversight. So we still have to use the resources and the information that we have available today. My research team, they're new. I mean, I've only had them since 2017, but the work that they've already done to be able to pull together and to build kind of dashboards. And they did a presentation to me a few weeks ago. I was blown away because all this time I thought we were living in the world of Excel spreadsheets. And then now I have a team that's been able to use what we have and to use certain systems to be able to pull information to where I can get some limited, but I can get some real-time data that we can use for oversight and accountability until we get our larger system. Our existing IT system is 30, 40 years old. It does have to change, but I do want to make sure that we are developing kind of these interim steps so we don't wait to be able to improve the work that we need to do.
Very good. Well, that's a good answer, and I thank you for that and your confidence as you move ahead. I will not be in a position anymore to be overseeing a lot of this or complaining about it or raising heck about it, but I will be doing so from afar. And I do want to consider a resource, in my private citizen hat that I'll now be shortly wearing. But it's certainly a problem in state government. We're just absolutely failing the people of California that the legislators and the governor represent, because we cannot get control of the application of IT, and IT companies are mining the state, just like the gold mines of long ago, mining the state taxpayers for these systems that fail. And then we have to do it again and again and again, and then apply new technology. Again, excuse me for complaining, but this is an overriding issue for the state of California right now, and the people are the losers. Thank you.
No, thank you, Senator.
All right, Director, I'm not sure if you have any further general comments or other things you'd like to provide to the commission.
I just want to thank the commission for their work and the opportunity to be here. I'm looking forward to my continued work with our community. They're remarkable, being able to work with the regional centers on solutions. We've been able to do many things over the last several years, and I know we have quite a bit in kind of the planning phases, but then also our self-advocates and family members. We have a number of avenues and things that we can do. I'm looking forward to my town halls. We're also looking forward to being able to standardize some practices on short term and then having a longer term kind of strategic focus. And so certainly welcome the opportunity for recommendations and our continued work with our community, because they are what matter. Thank you.
Thank you, Director, and thank you for taking the time to be with us today. And I'm sure Tamara and the commission staff will be in touch with you with further follow-up questions.
Excellent. Look forward to it. Thank you.
Very
Tamara.
much.
Thank you so much. All right, I will now call up our next two witnesses. We'll have them come up as a panel together. First, we have Tony Anderson. Tony Anderson has served as the Executive Director of Valley Mountain Regional Center since 2017. Valley Mountain serves San Joaquin, Stanislaus, Amador, Calaveras, and Tuolumne counties. Previously, he served as the Executive Director of the ARC California and has held various leadership positions in the field of developmental disabilities. We'll also invite up Gloria Wong. Gloria Wong has served as Executive Director of the Eastern Los Angeles Regional Center since 1994, where they serve cities and communities in Eastern and Northeastern Los Angeles County. She first joined the Regional Center in 1977 as a service coordinator. Thank you both so much for joining us today.
You're welcome. Can I go first?
Please.
Thank you for including me today, and this has been a fascinating conversation. And anytime I think you want to just stop and go to the questions, I'm open for that too. This is my 35th year in developmental services, and so I've seen a lot of different things over the years, and I've worked with many of you over the years on the other side there. So I did want to answer some of the questions though right away and see if we can't get some more understanding of our particular regional center. And you may not like this comment, but it's one regional center, you know, can be very different than the others, as you all have been talking about. And I'm responsive to the needs of my local community and my board of directors, as well as the state of California and the Department of Developmental Services under contract. So, but you know, we are going to have some differences based on the priorities of my region and my board of directors. So our regional center is a middle-sized regional center, and that means that we're serving about just over 18,000 people in the counties that Tamar mentioned. So that's still a lot of people, and in other states that would be an entire system. So and then we serve urban and rural, and we can get into some of the differences that we have to go through when you serve completely different regions like that. Our budget is about $44 million for our operations. And that we've got about 500 staff, or we will have about 500 staff by the end of the year. So we're very optimistic, thanks to the legislature, to hire more service coordinators. A dream I've always had in my career here, that we would get closer to the ratios. So we're at an unusual time here for us. We at our regional center also, we grow. We're growing at a very high rate. We in the pandemic, we took about a year, maybe a year and a half, where our numbers dropped significantly, and then we recovered quickly. And now we're at a rate much higher than before the pandemic. And we bring in about, we find eligible about 262 new consumers every month, and so. That's the rate of growth that we're looking at our regional center. Most of those are going to be children in the early start program, so 0 to 3, and many 0 to 5. And so with the new caseload requirements, that's quite a few new service coordinators that are going to be required each year. And so that's sort of what we're looking at in terms of our growth. So the other is, I did want to answer the question about the age and the distribution of ethnicity. And the way we've been looking at our regional center lately is almost as two separate sections. So first of all, the adults. In our adult population, we actually have more consumers that are that are school age and younger. So we're a younger regional center. Some are a little older. Ours is a younger regional center. But in the adult world, about half of our consumers report as white, as Caucasians. And so you look at that section, and then also those services are going to be more costly. They're all going to be in some type of a program in the daytime. Also the employment, and we're also looking at residential types of services that are there for the adults. So that's about half are Caucasian. We have the distribution is about 26% Hispanic, 10% is African American, 8% Asian, and 7% identify as either other or they will not tell us. So they decline to state. And so that's the makeup though of the adult population. But in the our younger population is much different. So what we're looking at is currently in the younger population, we're looking at 43% Hispanic. So, and that's our largest group, 23% Caucasian, and then we've got 7% African American, and 9% Asian, and then we have 17% identified as other or mixed race. We have a lot that will identify that way, or they do not want to state their ethnicity. So it's kind of the background and the look of the Valley Mountain Regional Center. So the other question I did want to answer that you had was regarding the monitoring of service access and equity and evaluating the causes, because we're doing a lot of work in this space. So what we do get from DDS are reports every year, and then they slice the number. They give them for all the regional centers, and we look at those who don't have any services at all by ethnicity, those who receive different kinds of services, the age break. There's 30 different ways that the state looks at the data, and all of that can be helpful and lead us into some directions to explore and ask more questions. And we put those on our website every year. Every regional center does that. And then we also archive them for the past year. So if anybody wanted to look at a past year versus the next one, all these reports that we get from the department, we place them on there. And so, and then we use several of these reports and we put together PowerPoints. We go out to the community and talk about what is in the report, what we're hearing from our community, sessions that we have continuous focus groups out there throughout our community to learn more. And then we get feedback from our community on those. And we do a group in English and Spanish with Spanish translation. We do another one with Spanish with English translation. And then we do another one just with our South advocates, spend a little more time. Sometimes with all these numbers, it becomes very convoluted and not easy to understand. So we'll spend a little more time answering their questions and looking at graphs and things like that. So we do the South advocates as well. And then of course, we do our board meeting. So that's how we get the data out there, the information out there to our community about what we're learning. And then it's a continuous flow throughout the year too. So there are other ways that we look at it. We started looking at some really tight age bands because we know that age is when I described how it's so different in the ages. Well, what was going on in terms of like if I could do 1 year age band, I probably would do that too. But that's even more work. We don't have we don't have data people that work in this field, so I got to try to grab people for that. But what we started to look at these age bands, like 2 year age bands, and see if there's something that would show us more information. And for us, though, the one fascinating thing was that we learned that there was these ages from 10 to 12, and then another grouping from right after high school that we did see some more significant differences. And we try to figure out what would that be about. When you looked at the full, all the younger years, you didn't see it as much, but we knocked it down to a couple of years. We started to see some more differences. And what we were looking at, just so you know, we were looking at the as a proportion. So we were looking at whatever the ethnicity was in the age group, what proportion did they make up of in the whole regional center of, say, 6 to 8 year olds who were Hispanic. And then what was the use of services? So we just looked at, was the proportion of the population, did it match the use of services? So we thought that might help us as well. So we added that as another data source, but it really was revealing for us. We started talking to families about well, what is it? Try to find families in these particular age brackets, and we just had these focus groups to see if they could even figure out what maybe they thought it could be. We did learn a lot. I've listed them out in my report to you. We could cover any of them as we go, but it's a continuous learning. We're trying a lot of different things. We're doing a lot of different activities, but we're also learning all the time. And I would say that, you know, as we go out there, we do make mistakes on different things that we're trying to do. We think we're onto something, and then we learn that we're on the wrong track. And what happens is the community is really great at letting us know, and then we just sort of we correct as we go. So for us, we've learned that it is definitely a process, is a learning process, and it's a continuous process. So we wanted to just check the boxes right from the beginning and say, okay, now we would be suddenly culturally competent as a regional center and responsive 100%, and have 100% trust. But we really learned that this is a journey. It's an ongoing process that we have with our community, and we make strides, and then we go backwards. We make strides and go backwards, and a lot of it has to do with the amount of time that we can spend with our community. And so it's improving. I would say the relationship is getting better and better because we're out there more and more. So, and that's where we are as a group in that area. We have continuous meetings with different community groups. We have a monthly meeting with our group. We've got the Integradoras. It's a small group of advocates, and they help different families. We had a lot of tension with this group early on, and then we continuously go back and forth on what's working, because we have a lot of great success stories, and then we also have moments of tension again. So that's another one of those dynamic relationships, but very important to have, and then go through some of those those learning pains that you have to go through on something like that. But it's continuous. And we've been doing that now for since about 2018, I think, is when they really were up and rolling. So that one we do. We've got other groups that we work with quarterly as well. Anytime our cultural specialist reaches out and says it's time for a meeting with a particular group, they want to meet directly with me, and I meet directly with these groups throughout the community or in the regional center. So we've always been trying to make the regional center a place that belongs to the community, and so we make it available here. But now with COVID, a lot of people want to do the Zoom, and they're just not comfortable, 100% comfortable getting out there yet. So,
Mr. Anderson, if I could just interject real quick, I'd like to ensure we hear from Ms. Wong as well, and then maybe the two of you can field some questions together from the commission.
That sounds good. Gloria has been doing this longer than me. She's much smarter.
Well, thank you very much, commissioners. I appreciate your giving me this opportunity to speak to you exclusively about East LA Regional Center. We are rather unique. And I do want to talk to you, my focus, and I won't repeat the same points that Tony has made, but I want to focus on the uniqueness of ELARC, and particularly on a project that we have undertaken that I think shows the great success that we've had on improving disparities, and a project that is now being spearheaded to other 20 regional centers as of this fiscal year. So with that, again, I've been with the system, as Tamar said, for a very long time, 45 years of services with a single regional center, Eastern Los Angeles Regional Center, served in various capacities, and as director, going on 24, 25, you lose track after so many years. It has been a very long time, but there's a reason why I stay with ELARC. It's just, you're rooted to the organization. You're rooted to the community that you serve. I began, not unlike Director Bargmann said, as a service coordinator. And so I can tell you from 45 years, service coordination is very different 45 years ago than it is today, and the challenges and the extra work that is done by service coordinators. So with that, let me just tell you a little bit about our regional center exclusively. We are, as Tony had mentioned, is regional center, medium-sized center. We're probably right below him. We're serving 13,000, just about 14,000 consumers are served by Eastern Los Angeles Regional Center. Our budget for 22-23, and as you know, a budget is broken down into two categories: purchase of services as well as operations. And the total budget for us is $387,451,305. When you divide those two categories, purchase of services makes up $347,158,363. That represents 89.6% of our entire budget being spent. And POS, purchase of services, is a category that supports those 14,000 consumers in direct services that are being purchased to assist them in whether it's residential or staying at home. The staffing side is the operations side, personnel, operating expenses, and that is at $40,292,942, representing a 10.4% of that entire total budget. We, as I said, we're a medium-sized regional center, but we are growing in the processing of payments and the budget that is coming. We have a purchase of services unit that processes those payments right down the hall from me. $25 million a month is being processed on a monthly basis to support those services that are being funded for those nearly 14,000 consumers of Eastern Los Angeles Regional Center. The demographics of Eastern Los Angeles Regional Center, I think, is rather unique statewide, as well as for the LA County, our other 6 other sister centers. We have our 3 largest ethnic groups: Hispanic, Asian, and white. We service Hispanic families at 69.86%, nearly 70% of our population. Asian families, and within Asian, that does include the Vietnamese, Korean families, which we have, but largely that is our Chinese families and community that we service, and that represents nearly 13%, 12.90%. Our 3rd largest ethnic group is our white families at 8.79%. You do have in the material that I sent you, the balance of that is made up from multi-ethnic groups at 4.88%. Other is 2.11%. Our African American community is 1.45% of our total population served at ELARC. What is the unique part is those first 3 ethnic groups that I just mentioned: the Hispanic, the Asian, and our white population. That constitutes 91.55% of our total population served. So with that, I do want to move into sharing with you the project that we have undertaken, the results of that project, and why that particular project then focused on our Hispanic and Asian families, because they were the ones that were in the lower per capita of purchase of services or on the no POS side. This is a special project that we began right at the inception when the funds were being made available through service access and equity grants. And it was the very first year that it was launched. And at that juncture, it was only regional centers funded. It was in subsequent years that community-based organizations were put into that mix. So this was started by our regional center in 1718. And the general concept of what we call the enhanced caseload project, the elements of that is that it is limited to 200 consumers that are part of what is this division. we have a lower caseload ratio. Typically caseload ratios, probably the highest is at 1:66, and that's what we should be. But unfortunately, with the funding that we've received from the legislature for this year, we're going to make corrections. But those corrections are moving us out of 1:80, 1:90, 1:100 caseload ratios when they should be at 1:66. And there are many other categories. But when we focused on this back in 2017, it was that we recognized you need to have a better working relationship with families in order to get to the issue of disparity and inequities and to better understand it. So our project was about focusing on a small number. It's 200 families or consumers that are part of the so-called enhanced caseload project. We focused on our Hispanic families and Asian families. And we offered 5 service coordinators a caseload of 1 to 40 in order to handle the 200 cases. To date, we have transitioned 191 individuals out of this project. And as I have graphs, and I know that the audience, you as commissioners have access to the information I gave you, but I think visually it's just impressive to look at the changes that were made over the period of time that these families have been part of the enhanced caseload project. We do not keep individuals in the project for an extended period. Typically, the length of time that they stay is 18 to 24 months. We want to give an opportunity to other consumers that are in the low purchase of services average per capita or that have no purchase of services. So we consider this a continuous movement, but it does take time to sort of build up and move on to an improved average per capita. The project objectives, and as is included in your in my testimony, the project aims to strengthen trust and communication and to improve the service experience with a substantially reduced caseload ratio at the 1 to 40. The 3 primary objectives of the project are: Objective 1, provide enhanced case management services that focuses on understanding the needs of the entire family, not just on the consumer. Objective 2, to provide education about the regional center system, some very fundamental issues that sometimes are missed by families that have no purchase of services or on the low no purchase of services. Objective number 3 is to gain a better understanding to the barriers that these families have in accessing regional center services. Over this 4 fiscal year, and that's what we've been running this particular project, we've had absolute success. It is a small number, undoubtedly. We would love to expand this and have 1 to 40 caseload ratios to much more than 200 consumers and families that we are serving. But if you look at the graphs that I have shared with you, they tell the story of that movement over that 18-month or 24-month that they were in the project. In 17-18, our very first fiscal year, our Asian families, and it was typically Chinese, there was an increase in services or expenditures of 109%. For our Hispanic families, it was 113%. That continues in 18-19, the following fiscal year. And you see even more of an increase on the percentage of change. For our Chinese families in the project, it was 180%. For our Hispanic families, 217% increase from the baseline of the expenditures when they first entered the project. In 1920, they went up astonishingly. Chinese families went to 940% and Hispanics 308%. I will just add an asterisk to that 940, which is quite unusual. What we did have is 1 individual out of that total went to residential placement, and has been mentioned before, residential service costs are our highest costs, and that was the spike that happened there. So, and then we're in 2021 and we are at, we didn't have our Asian consumers graduate from the project, but for Hispanic families, there was a 400% increase in the expenditure trends. It is something that without a 1-to-40 caseload ratio, it would be impossible to do what we've done. I can tell you that we do begin, as has been commented by public comments, we do begin with one thing that's been talked about, generic services. That is a starting conversation with these families and consumers coming into our systems. And we do find that that is a gap area that families are looking for, whether it's Medi-Cal, IHSS, SSI, dealing with their private insurances. There's a tremendous amount of time that is spent on just walking families, consumers through that process. So that leads us to that 18 to 28-month average stay in the project that moves us into a graduation of this project with the level of success that I've shared with you. Beyond that, what I've also shared is we have run information, what we call a community report, and we sort of just highlight some of the stories from participants in this project. I won't go into the details, but this gives you a personalized approach of what these individuals that were part of the project found of value, of which included whether it was counseling, ILS, going to higher education, getting personal assistance, generic services, and a very large aspect of our assistance with these families.
Ms. Wong?
Yes,
Just,
please.
just real quick, Commissioner Buiza has a question, and as we
Please.
mentioned before, interruption is the greatest form of flattery.
Yes.
The commissioners are engaged and they want to follow up on topics that you've discussed. So Commissioner Buiza.
Yes.
Thank you, Commissioner Varner. I was prepared to let Gloria finish, but I'll ask it now.
Yes.
You know, what we know after the pandemic is these particular communities you mentioned in your testimony have been some of the most affected by COVID. And I'm curious because I didn't see it in the testimony, both from you and Tony, what was the additional new levels of disparities or barriers to access that this already distressed population that you're noting in your testimony have experienced during the pandemic? Has it changed since then? Or not that the pandemic is completely over, but I'm asking this because, you know, we never know when another pandemic is going to happen. We need to learn the lessons of situations like this so that these particularly vulnerable populations do not die in greater numbers, get sick in greater numbers just because of the barriers and the disparities that are stacked against them.
Right. Excellent question. And, you know, through the pandemic, it was all about pivoting different services. And for each one of our ethnic groups, it was different. We obviously went into what we called alternative services. You did have the support in the community. We needed to come up with alternative services. Many things fall under that, but it was to be unique to whatever the needs were of those families. So a lot of alternative services, which we're now changing to tailored services, participant-directed services came into play. Health and safety waivers, many of those were given, and that is when we had the standard policies and procedures and they weren't the right fit, we needed to come up with enhanced services and we needed to get additional support, funding to be increased. Technology was also a challenge for these families. We stepped in and offered services on that. So we did have to pivot. We needed to just look at what those gap areas and those barriers were changing from originally when pre-COVID, when those challenges were at that point, as families would be telling us, we're dealing with the challenges of education limits me accessing all these generic services, all these applications. Socioeconomic plays a role for our families. So that's where we needed to step in. But regardless, and I think this goes back to since the time of the Lanham Act, as Director Bargmann said, we have always adapted to those changing needs. That is the uniqueness of our community and being responsive to each unique community for each regional center. Tony's population is different, so is East LA Regional Center, and that is what we need to be responsive to. So I hope I gave you a little bit of highlights on that, Commissioner. Did I need to answer anything further?
Just a very quick follow-up question. So my understanding is, since that's a pivot, does that become a permanent part of your infrastructure how has it changed how you now approach service coordination and delivery and even oversight for your service providers? Because we can't say we can't go back to the way the things were, because we knew that some of it didn't work.
Absolutely. And that's where many families are seeing that those alternative services in whatever mode it is, and they were all unique to families. How do we translate that? And we are working with them. It isn't going back to the traditional system. So it's reassessing what worked and what didn't work for those families that guide our discussions with the focus on a person-centered practices approach. So I mean, it's a multitude of things that have changed under these categories of alternative services, health and safety waivers. And as a matter of fact, I will add, this is something that's new for this year. There's a position that has been authorized. It's called Health and Safety Interactive Specialist. And it's recognizing that in this one position, the uniqueness of that individual to be able to work with these families on services that were created that were quite unique, and that we can then get exceptions to that. So we have a specialized position that the legislature as well as DDS promoted. And I can tell you, this is, you know, the project that I'm referring to here, it's not the only thing that we do. There's so many more elements, but before I continue with that, I'm going to turn it back to the commission. I think there may be some other questions of me before I proceed with the next segment.
None for me, thank you.
Thank you.
Do we have any other questions from the commission? I would like to just see if Commissioner Emerson has any questions, because I don't think he has a raised hand function.
Okay.
Yes, I have one question I'd like to ask both Ms. Wong and Mr. Anderson. First of all, I want to thank you for taking time to testify before us today. Your testimony was very interesting and helpful. The question I want to ask is, salaries of most regional center executive directors exceed the salaries of DDS Director Bargmann and even the governor. Since regional centers are completely taxpayer funded and are really quasi-governmental agencies, do you think the salaries should be capped?
Man, what a question. Well, I guess I'll take that. You know what, I as a nonprofit executive director over many years, I've seen a huge difference in the salaries of nonprofits, and ours are published for the regional centers. They're published on our websites. Our 990s are there. The boards have a process where they make these decisions. These are very large nonprofits. So we're talking in just our operations alone at $44 million, and the amount of oversight and activities that are involved. I hope that it's a lot of work, and it seems competitive with my county counterparts. So, and other larger nonprofits that are of the size. So, in terms of a cap, I'm not sure proportional what would the analysis be, but I think that would be fair to do an analysis of what is a proportional salary to the sizes of the budgets.
And Commissioner Emerson, this is Gloria Wong, Eastern Los Angeles Regional Center. I agree with my counterparts, Mr. Anderson's commentary. I will add the importance of the oversight of a board. I report, my bosses are 11 members, and they are the composition of our board, and it is very clear cut on the requirements, but it's quite unique for us. We have 11 board members, of which 25% are required to be consumers and 50% to be parents. 100% of our board are parents and consumers. We haven't had to bring in professionals. We meet all of the requirements based on the families that serve. So my request would be to always look to a board, the uniqueness of my 11 bosses, and I look to them to make those decisions. But certainly, I think, as Tony has said, any suggestions that the commission has, we would be willing to entertain and certainly take it back to our board of directors.
Thank you. And maybe a follow-up question then. How are your board members chosen? Or who chooses your board members? Maybe it's a more appropriate question.
Yeah.
Go ahead, Tony, go ahead. I'll go after you.
We put a lot of energy into that in our board. And our board of directors is 21 members. As you know, it's a requirement for 50% to be consumers and families, and at least 25% to be people who receive the services. So, and then we have others that are from the community who are meeting different requirements like legal, business, public relations, I think is still on there. So there, we have some certain areas that we have to meet. But what we do is we do an application, and our board does all the selection. That's not something that I do. So the board of directors has a committee, a nominating committee, and they do a very extensive process, an application process, and then they also interview all the people. They're looking for the ethnic, racial diversity and meeting certain needs that are there. We have requirements that we have to make sure that it's well-rounded, meet all the requirements in the Lanterman Act, and then also they are looking for people with experience and people who are really going to be there for their whole community, maybe not just themselves, but the whole community, and can they all work together? So they're the ones who make that selection.
And if I can just add to that, ours is not unsimilar to Tony Anderson's response. We do draw from existing outside community committees. The Consumer Advisory Committee meets on a monthly basis, and so we always put that out to them when there are openings to submit an application to the board of directors. We have parent groups that meet. We also pass on that information as well as posting it on the website when there are vacancies. So ultimately, those applications are then submitted to the board of directors, a board selection committee who conducts an interview and makes a determination and presents the results and nominates members that they have interviewed to the full board.
All right. Thank you for your response.
Welcome.
Great, thank you. I've got a couple other commissioners with questions before we wrap this up. Commissioner Byer.
Thank you, Commissioner Varner. First, I'm very tempted to be supportive of higher salaries for people in nonprofits. So I don't want this to be misunderstood. I'm not seeking to cap anybody's salary, and you guys do an amazing amount of work and you've made a lot of sacrifices. However, we heard from the director at the state level about standardization of the intake process, standardization of choosing vendors. What would be wrong with a standardization process on setting salaries separate and apart from 21 different regional boards of directors who use different criteria to reach different results? Wouldn't it make sense to have a set of criteria on that's the first question. And the second question, also to have sign off on the choice of a regional center director by the head of the State Department of Developmental Disability, in the same way that a cabinet secretary chooses regional directors in the federal government, or companies choose regional or national heads of units within a company. Maybe if you could react to the idea of standardization on salary, not without setting limits on what it is, but what criteria should be used. Should it be comparable to state employment, federal employment? How do you take into account pensions, local, environmental, economic circumstances, et cetera? And then whether the state director should have, if not a role in choosing, veto ability over the choice of a regional center director. Thank you.
Let's see, the first one was the
Standardization of the salary?
The standardization.
Standard criteria. In other
The
words,
criteria.
I've been
Yeah.
on a lot of
Yeah.
nonprofit boards. I wouldn't want them setting my salary. Especially if it was, a 9-member board, a 21-member board. They have different levels of expertise. Some of them, frankly, there's a risk of self-reference. That is, they're friends with or have been associated with the director for a long time. So it makes it a harder conversation unless you're using standardized criteria across the state for setting the salary of the director of all the regional centers.
I think that most likely this happens, but I can't say for sure. But because we've seen very similar recruiting firms and what they use in terms of when they're building the salaries, and they look at the regions. So if you're looking at the different area and what's the cost of living in that area, that doesn't make sense that you would do that. Everybody would do that to make sure that the person would be able to live there, and that they would be able to have a cost of living that would match in terms of the size and scope of a job like that. So that type of a thing. The other would be that the type of experiences. I think that makes a lot of sense, that you would want to make sure that somebody that was coming into this position had a pretty well-rounded background and experience, and understood today's needs in today's regional center. And so I think those kinds of things, that makes a lot of sense for an executive director. Without it's getting a little dangerous having one executive director say that, and then I don't want to say that any other local board of a certain community someplace has to do what we do in Stockton. But there are some of those general things that you mentioned that do make sense to me as an executive director. And I've been an executive director for many years in many different settings throughout my career. I think that's a standard thing that you will find with different recruiters.
And this is Gloria Wong. I would agree with Tony. Keep in mind, probably what you want to look at is the core staffing formula, which is the basis that builds the budget for the regional center system. And, it's just over time, these are things that have become stale, the rates. Not everything is funded at the same level that it should be. So maybe it all should be looked at. And then maybe that's a consideration, so that there's a standardized, but there's an equivalent to this a state position or something that's more current. So I would just urge that we sort of look at the basis of how we build these salaries from a core staffing formula that's really out of date, that we need to tackle.
And the second question was, should the state director have a say in choosing or having veto authority over the choice of a regional director? It's hard to imagine a oversight system that doesn't permit the person in charge of the state money having authority over the director of hundreds of millions of dollars. But that seems to be the case today.
This is Gloria, and I'll open up instead of giving it to Tony first, and I'll let you answer last. Maybe it's the state of growth, the evolution of our system from 1969 to now, and how large we have become. Maybe it does have to become that, but keep in mind what we're giving up, something that the community values, that we have remained an organization that's responsive to the very community that we serve. Maybe we've just outgrown that concept, but that means a lot to the communities as to how the system started.
Yeah, not much to add to that, though I do see some, and I think this does happen where the department does talk to the boards about what they're looking for and what the department is saying that this is a best practice. I'm not even sure how far what the level of detail that is. I do know that the board of directors do talk to the association, and they also talk to the department when they're doing that. This is in a board of directors for the nonprofit, it's one of the most important things that you do as a board member, and you got to get that right. And when you make the mistake, it really is disruptive for the whole community. So As much feedback that they can get, I completely agree with. Any guidance they can get, I completely agree with, but they are local boards, and that's a hard one to swallow, that the state is going to tell the local board what to do on that in that kind of black and white way. But I do see that there is a lot that can be done there.
Thank you. Commissioner Sidley.
Yes, thank you both. I appreciate your testimony today. I want to build on what Commissioner Byer and Commissioner Emerson have been talking about in terms of the boards. And I have two specific questions. My first one is, what would you, and I've heard you say very clearly, is it's community-based and the community feels very strongly about that. But going back through some of the questions that I had for the director, what would your thoughts be if the boards were expanded from 21 to say 25, and those 4 people were considered for, in a corporate board situation, you have independent directors. So you would add 4 that come out, and I'm making up the numbers, but the concept is the same, that you would have 4 sort of independent voices who would also be on the board to lend a voice to the decision-making process. What do you think of an idea like that?
I want to go spend some time with Christine.
Oh.
Turn this off.
I'll jump in
Go
on
ahead.
that. So, and are you talking about specifically the selection process on the bringing in the others, or all the time?
I'm talking about the state or the agency or somebody would be the selector of the additional 4. So it would be outside of the purview of the community, but they would be, they would be indirect members of the board, but they would then, once they're selected, they would serve as board members like the 21 others, but you would have a voice from somewhere else as a participant in the board.
So Commissioner, they would be nominated, is what you're suggesting, by this outside body. It wouldn't be the full board nominating or looking for these outside entities that were not part of our community?
We would have to create, I mean, there would have to be a change in the act, but there would then be some number, it could be 1, it could be whatever, but some number of board members that didn't come from the normal nominating process. They would be someone outside of the system. So bringing in a different set of eyes. I would not suggest something where these sort of third party, for lack of a better description right now, would overwhelm the current 21 of the community, or that could outvote. It would just be another viewpoint in the discussion at the board level.
Mm-hmm. Yeah, it's interesting. We do have a position, actually a couple of them, but we have a position where a provider is amongst other providers, and they're selected by our providers, and then they serve on our board. Our board doesn't get to go through the selection of that person. So it is similar to what you're talking about, where an outside body, which is our provider community, does a selection and then places on our board. So that does work, and it's really helpful for us because they have a whole unique perspective. We also have our self-advocacy council that does the same thing. We don't select them. Our self-advocates, people with disabilities, select the person and they are automatically placed on our board. And so what you're talking about is not without precedence in terms of, but that's coming out of our local community. For that to come from the state level would be a whole nother thing. I think I could see some utility, but I also think that would need a lot more conversation, because you're talking about somebody from afar, putting somebody onto our local board and saying that they must be there, and you don't have any say as a local board.
Right, and I'm saying that and making that suggestion because we have heard some discussion from some people who say that that if you know people on the board, you might get more services, you know, or things like that. So it is a tool in a toolbox to get rid of some of the preference treatment that some people might get. So, and again, I'm just tossing it out as a concept, as a suggestion, something to consider. You do see this in corporate boards where you see, you know, outside directors. And so, you know, and I'm here to discuss and think about potential ideas that provide solutions to what we've heard from a lot of the testimony of people feeling that they're not getting the same treatment within a regional center, or they're discriminated against, or because they've complained and then somebody doesn't want to give them services. So I'm just trying to talk about different ideas. And along those same lines, if you could just educate me, do the boards meet in public? Is their agenda posted? Are they Brown Act meetings and people get to speak? How do those boards work?
It's in our Lanterman Act, the requirements of the board meeting and the board notices. And so all notices for the board meeting, any public, even committees that are public that if that committee can make a decision, those will be on the website as well. But the board of directors, those meetings are on there, the minutes are on there. They're 7 days in advance. So, you know, it's a little different than Bagley, Keene, or Brown, but they're specific in the Lanterman Act of the rules of what the board must do in terms of its meeting notices. So we do have.
And how often do they meet publicly? Is that also in the act that they have to meet once a month, once a quarter, once a year? Is that in the act?
I would just add, it's the bylaws. So for each regional center that dictates how many. For example, for East LA Regional Center, we have 2 dark months, August and December. We meet all the other months. They are before COVID, pre-COVID, it was all in person. It has been Zoom. I can tell you from the Zoom experience, and there's very few positives since COVID, but this was one of them. We have greater participation at our board meetings than we ever had with in-person meetings.
That's great. Okay.
Thank you. We're running into a hard stop here coming up. I know we have one more speaker, so we have Commissioner Erner that has a question, so I want to keep this moving along. Thank you.
Mr. Vice Chair, I have a follow-up question as well. Thank you.
You're frozen, I believe. There you are.
I'm sorry. There we go. I'm sorry. I was going to make a couple of comments about choosing of executive directors, because there have been some wonderful experiences, but believe it or not, there have also been some terrible experiences where it might have been nice to have been able to have the DDS director say, you know what, enough of this already. Because boards didn't feel, for some reason, boards were not in a position to be able to say, this is not working out for us. And that meant that the consumers and the staffs at the regional centers really, really, really went through very difficult times. And so the idea of having some way, I'm interested in that idea, just because of the history of choosing, right? And then I have just one other question, because Gloria, when you're talking, you're doing this pilot project, right, which sounds very exciting, but can you tell me the percentage of the ethnic groups that actually get, right, that are not in the project, that are outside of the project, of the Hispanic community at your regional center, how many of them actually, what's the percentage that actually get a purchase of service of some sort?
It is, I believe, I don't have my no POS. I think our no POS is probably at about, I'm going to guess because I don't have the info, I think it's about 13%.
Okay. All right.
Receive some level of funding.
Okay. Because I think everybody on the commission needs to understand the word entitlement is thrown around very lightly in this system. What really it means, at least in the world of the people who are living within the system, right? Meaning the consumers, they are entitled to be enrolled at a regional center. That's about the extent of the entitlement. So when the state of California says it has 400,000, people receiving services from regional centers, that could include just the entitlement of being included at the region. In other words, going through the application process and having been approved. It doesn't mean that that they're getting services necessarily. Some people consider just the application process to be a service. And so, but the entitlement really is about getting into the regional center itself based on whatever the eligibility standards are. It's not necessarily that a purchase of service is delivered. We hope it is, but it doesn't mean that it is.
Mr. Vice Chair, I did have a short follow-up question.
Sure, go ahead, Commissioner Emerson.
Yes, I would like just a short answer from each of you. Is how personally involved are you in picking your board members?
I am not personally involved. It is the board chairs, the executive committee that makes that decision.
Yeah, and I don't make the decision at all, although we do, our staff does help in the process and help managing the committee, you know, sending out the applications, getting the information, making the phone calls that the board says to make, all of those things to help the committee move along and make their decision.
All right, thank you.
Mhm.
Okay, I think that concludes that portion of our testimony. Mr. Anderson, Ms. Wong, thank you very much for your time. We really appreciate you spending some time with us and giving us your valuable time. So
Thank you.
Thank you.
with that, Tamar?
Mr. Vice Chairman, if I may just jump in briefly, because we
Sure.
have a slight change to the agenda, given the length of this meeting, although it has been an excellent hearing, but the length of this meeting and also the number of members of the public who are on the call and have requested to make public comment. We've contacted Mr. Carruthers, and he has very generously agreed to testify at a later hearing. We're going to add one more hearing on this topic so that we can hear from Mr. Carruthers and so that we can take additional public comment. We've had more than 300 members of the public on the call at various points today, and many have indicated they wish to make public comment, and so we'd like to accommodate as many of them as we can. So I've spoken to Chairman Nava, and we've decided to add one more hearing on this topic at a date to be determined, and so we'll tell the commission about that. And at that hearing, we will hear from Mr. Carruthers and then take probably fairly extensive public comment. However, if we can, at this time, I'd like to move, if it meets with the commission's approval, Mr. Vice Chairman, I'd like to move to public comment now so that we can take some public comment today. Members of the public have been waiting very patiently to make public comment, and then we will hear from Mr. Carruthers and take additional public comment at a later hearing. So again, if you're a member of the public, we're going to limit we lose our translation service at 3 p.m. So we're going to take half an hour of public comment. But then if you are not called upon today to make public comment, hopefully you know about this hearing because you're on our email list. You'll be notified of a later public hearing at which the commission will take additional public comment on this issue. So Mr. Vice Chairman, if I can, with that comment, we'll move now to public comment until 3 p.m.
I think that is fine. I'm happy to hear that our esteemed chairman is still wielding some power behind the scenes there.
And so I'll ask the staff to go ahead and put those instructions back up on the screen. So for members of the public who wish to make public comment, you may use the raised hand function in Zoom. I can say now that already many members of the public have raised their hands. So if you're not already in the queue, you may very likely not be called upon to make public comment today. I apologize for that, but again, we'll create an additional opportunity. Also, I might mention that if you email us with public comment at littlehoover@lhc.ca.gov, I assure you that those comments will be read. I am myself reading every public comment we are receiving on this issue. I'm a little behind, but we are reading them. And so those will figure into the commission study. So you may email us public comment, but if you want to make comment to the commission, use the raised hand function in Zoom. If you're not called on today, we'll proceed with additional public comment at the later hearing. Your public comment is limited to 3 minutes. If you've already made public comment, you certainly have every right to do so again, but please be cognizant of the fact that we have many people who requested making public comment on this issue. So if you've already made comment in an earlier hearing, please consider the needs of others. You have 3 minutes. You'll be able to be heard by the commission, but not be seen by the commission. And so with that, I will ask Ashley to go to the first person on our public comment queue.
Great. First up, we have Amy Westling. Amy, you now have the ability to talk.
Good afternoon. My name is Amy Westling. I'm the Executive Director of the Association of Regional Center Agencies, representing all 21 of the state's regional centers. I did have the opportunity to speak at an earlier hearing, so I'm going to keep this brief and really just want to highlight that I think Commissioner Eriner raised the fundamental question that we're talking about today, which is how do we strike that balance between community responsive, community driven, community run organizations, and a greater level of consistency that we hear from our communities that they are interested in. We submitted a lengthy letter to the commission last week, and in it contains lots of recommendations for how to propel our service system forward without transitioning to a system that isn't reflective of individual community needs. We also indicate in their recommendations and commit to doing lots of work to increase and improve standardization, as Director Bargmann noted, in the areas of intake as well as vendorization, but also in increasing the ability for the public to find information on regional centers' websites, because there is a lot of information speaking to the transparency piece. Where are the dollars going? How are they spent? What are staff paid? What are services that are purchased? Those sorts of things. And then finally, we have heard the community loud and clear that family support should be more consistent across regional center areas. And so we commit to, by the end of 2023, developing a standardized assessment tool that will be used by all 21 regional centers to enable us to achieve a greater level of consistency in that critical support area. So really appreciate the opportunity to provide some public comment and remain very open to additional conversations with both commission staff as well as any commissioners if any questions arise. Thank you for your time.
Great, thank you, Amy. Next, we're moving on to Rick Hodgkins. Rick, you now have the ability to unmute yourself.
Zoom webinar. Can you hear me now?
Yes.
Okay. I'm glad that there's going to be yet another hearing on this topic because I spoke in the last two hearings, if you recall, also submitted an email. One thing I'd like to say, and again, I'll be back during the next hearing, is the DDS, in addition to what I've said already, that the department needs to get out of based on a special I heard on what was it, ABC 10 up here in Sacramento, that the department needs to get out of the business of conserving people. The mother had made special clothing for her son because of a skin condition or whatnot, and that when the department decided to conserve her son, he was put on boxing gloves were put on his hands to prohibit him from taking his clothes off or whatnot. And so for those reasons and many more, I think the department must get out of the business of conserving of conservatorships, especially since Assembly Bill 1663 was passed. So with that, I will be back at the next hearing to be determined by the commission. So thank you.
And actually, I'm going to interrupt, but before Ashley moves to the next speaker, I should have mentioned to commissioners, we may receive public comment in Spanish as we have previously. So if you have not done so, you may want to go down to the bottom of your Zoom screen, click on interpretation, and then click on English. That will allow you to hear, if there is public comment in Spanish, you will be able to hear the English translation. Ashley?
Great, thank you, Ethan. Next, we're moving on to the Shelton family. You now have the ability to unmute yourself. It looks like you're still muted on your end.
Ashley, given the press of time, let's move on to the next speaker, and we can come back to them if they are able to unmute.
Great. Next, we're going to move on to Irma. Irma, you now have the ability to unmute yourself. Hello.
Bueno. ¿Escuchan?
Yes, go ahead. We can hear you.
Pues más que nada, muy buenas tardes a todos. Les pedimos una traducción de la ley Lanterman a español. Solicitamos que se haga auditoría al Centro Regional de Orange. Y en algunas reuniones solicitamos que DDS se presente a los IPPs para que vean cómo nos intimidan, cómo nos tratan y cómo nos niegan los servicios. No más disparidad. Gracias.
Great, thank you, Irma. Next, we're going to move on to Alfredo.
Gracias a ustedes.
Sorry, next we're going to move on to Alfredo. Alfredo, you now have the ability to unmute yourself.
Bueno, hello, can you hear me?
Yes.
Yes, we can.
Yes, my name is Alfredo Güero. I'm a community organizer in Inland Empire in the area of special education. And for the community, it's very important to let you know that we need, I agree with the comments from Ms. Sidley, that we need a state oversight committee over DDS and the regional centers. The reason is because the money they give to go to the people to come to the community to give us the information from the regional centers for the parents is not complete and sometimes doesn't have no translation. It's very hard for the parents to deal with these issues because some of them doesn't speak English, some of them not even know how to read or write on the Coachella Valley. So they need better services from the regional centers. Is the other lady comment, they go to the IPP, to the IEPs on the school districts, and they receive very vast services, and they don't have any help from the regional centers. So the money is not used the way it should be to help the community. So the reason for me to talk about this is because a lot of parents doesn't feel like come out and talk because they afraid to retaliation. So please, I think you are the people who help us, our communities, who is underserved. So also, the DDS has to be more transparent about how they use the money, because a lot of organizations, not-profit organizations, receive money from them and doesn't use it the way they should be. They just make a report that they do this and that's the whole thing they need to present to the DDS. So please, we need transparency on these issues. Money is the issue. Money is being not used the way it should be. Please, thank you.
Thank you, Alfredo. Next, we're going to move on to Letty. Letty, you now have the ability to unmute yourself.
Yes, good afternoon, everybody. I am a parent of an adult consumer. One of the things that hasn't been discussed today is service coordination. And as we know, that is key to getting any type of services from the regional center. The coordination of services can't happen without the consumer services coordinator. And right now, there is a crisis in terms of retention and recruitment for the consumer services coordinators. And that is because the core staffing formula that Ms. Wong referred to is an outdated version of what the salary should be for that position. So right now, the salary for the consumer service coordinator, which is really the face of the regional center with any parents or consumers, this staffing formula has not been revised since, I believe, 1996. So the salaries that are being provided to the service coordinators is very, very low. I want to say somewhere around maybe $30,000. And so right now there exists a pandemic in terms of finding qualified service coordinators that will agree to be paid that amount of money for the amount of work that's needed. We've talked about how the disparities exist in the services, and if this will just continue to expand that disparity if we can't find bilingual service coordinators to work with families and get services to them, because we don't have the staff available, then we are creating a bigger problem for us. So we can't move forward at all until this is rectified, because again, if we don't have the service coordinators working with the families to find the services and access services, it delays the services to be gotten by the consumers, sometimes by weeks, sometimes by months, sometimes by years. And so, and if we're calling the regional center and the service coordinator has resigned, and nobody has filled that position, and more and more, as we know, people are resigning their positions in different companies and nonprofits, this is a big, big problem. So I really ask the commission to look into the core staffing formula and revise that so that we pay our service coordinators what they deserve. Thank you.
Great, thank you, Letty. Next, we're moving on to Kay Medina. Kay, you now have the ability to unmute yourself.
Yes, hi, good afternoon. My name is Kay Medina, and I want to thank you for having this hearing over the course of these past 2 months. And I want to say to Commissioner, it's hard to prepare a statement beforehand because so much transpires during the hearing. And so you kind of change course and you want to address certain things. And Commissioner Stidley, you are spot on. It's almost as if you are, I'm sorry, I'm out of breath. I didn't realize when my turn would be coming up. It's almost as if you were a fly on the wall at a lot of the meetings that I've been having. I am also a parent of a child with a developmental disability, and everything that you were speaking to earlier is spot on. I also want to highlight what Senator Nielsen said, is that we're just talking and talking and talking, and without a plan and without, sorry, I'm losing my train of thought, accountability, we're just going to keep talking. I was very disturbed, really, to see that Director Bargmann came and did not have a clear plan of action on how she's going to address a lot of these issues. And she even admitted that this is not the first time she's heard it, right? I've been dealing with regional centers and the Department of Developmental Disability for 4 years, and I've heard parents who have been complaining for 34 years. It's disgusting, right? We're spending billions of dollars, and you give more now to a child, and if the child gets it, we don't have time to wait, is the point that I'm trying to make. When kids go without services, they need more along the way. So you're spending all of this time trying to figure it out, and we're going to do this and we're going to do that, and that's a good idea. And I want to sit down and let's have a work group and let's have a town hall. but you already know what the issues are. So what is your plan of action? Let's try something. And if it doesn't work, then we will change course. We don't have time to keep waiting, is what I'm saying. So there is definitely a need for change in leadership at the Department of Developmental Services, and the change is needed now. Thank you.
Thank you, Kay. Next, we're moving on to Lisa Walker. Lisa, you now have the ability to unmute yourself.
Hi, my name is Lisa Walker, and thank you for letting me have the floor. And I would like to challenge panel of commissioner to take a look at purchase of services, mission statement, service codes, and regional center website. If you all can go to each regional center, take a look at that. And if you look at 21 regional center, they all have a different purchase of services. And it is my understanding the purchase of services are reviewed by DDS for 21 regional center. That is a lot of manpower. So if we can standardize their website, the purchase of services, and their vision statement, our mission statement, this is one way of standardizing the process, because consumer receive their services based on their purchase of a service, their POS. It's explicit state on their POS. So if each regional center has a different POS, that means each consumer of regional center will be receiving different services, although they should be receiving same services. So over and over, I hear standardization, transparency, and clear instruction. This is a way to get clear instruction, transparency, and standardization. And there are 21 regional centers. If we can standardize some departments like IT departments, that is doable. A lot of non-for-profit organizations, they have a one IT. So we can have a same website. If you go to each regional center, they are, the reports are created by DDS. It is listed differently. Some are put it all together, some are compartmentalized their reports. So regional center, there is a barrier because they're so compartmentalized. For even CEDAR, the program major, I'm not sure if all of you know what CEDAR is, but program manager cannot update it. They have to go through their the doctors, and their doctor has to update the CEDAR, so that we all have to wait. So there are a lot of barriers. So what we need to do first, think about standardizing and get rid of the barrier so that consumer can receive their services they're requesting by need basis. Thank you for listening.
Great, thank you, Lisa. Next, we're moving on to Felicia Ford. Felicia, you now have the ability to mute yourself.
Ms. Ford, you're still muted on your end, I believe. If you can unmute yourself. Ashley, she is still muted on her end, correct?
Yes, correct.
Ms. Ford, if you can unmute yourself. Ashley, let's go on to the next speaker then, and then we'll, Ms. Ford will hope that you can make public comment at the subsequent hearing.
Next, we're moving on to Daniel Schenkel. Daniel, you now have the ability to unmute yourself.
Mr. Schenkel, can you unmute yourself, please? Mr. Schenkel? All right, Ashley, let's go on to the next person then.
Next, we have Patricia Albano. Patricia, you now have the ability to unmute yourself.
Hi, good afternoon, everyone. I just want to say thank you so much for these hearings. I'm a parent of an 18-year-old who is a client of a regional center. And I just want to briefly share just a couple of examples of how difficult it is to access services for clients. So I think it was back in 2019, I had requested ILS services. My son at the time was 16. And the only reason why I was asking for ILS services was because there were a lot of other parents of the white Caucasian group that were receiving ILS services for their 16-year-olds. So here I go asking for the same service for my son who has similar abilities as them. And of course I get denied. And I get told, well, it's parental responsibility because your son is not 18 years old yet. So my question is, how is it that the white Caucasian families are able to receive this supports that per the law says that they're not allowed to get until they're 18? So, you know, that's still a question that I have. And so I went through the process. I was told to go to the clinical team to talk about my concerns and, you know, why I was asking for the support. The clinical team, you know, said the same thing. So they basically denied me. But in that meeting, which was full of a lot of professionals, one woman actually heard what I was looking for. And she said, you know, there is another service that will provide the same supports that you're looking for that is similar to ILS for a 16-year-old. And so I was so happy that she was able to offer that to me. But this whole process, just so you guys know, from the time I requested the service took 13 months. 13 months from the time I requested to the time that I had to jump through all the hoops and be told that there is a program that's similar for kids under 18. So my question is, why, when I asked for ILS, why couldn't they say, you know, that service is for adults over 18, but here's this other service. 13 months of my son not receiving support. To me, that's absurd. Fast forward to 2021. I asked for a referral to a day program in preparation for my son leaving high school. It took 8 months for the day program to receive a referral, not a POS, but a referral, just so that my son can get on the wait list. Again, I'm not sure why this is taking so long.
Ms. Albano, your 3 minutes has expired. If you can wrap up very quickly, please.
Sure. And I'm going to go ahead and email you guys, but I just want to say that, you know, I've been hearing people talking about salaries today, but I think we also need to look at tenure because a lot of case managers, service providers, there are families that have complained on numerous times for about these case managers, and nothing is done. They just get shuffled into other positions. The other thing, 2 things really quick. I would suggest also having hearings or interviewing service coordinators. I appreciate that this is being done for the general public, but I think service coordinators also have a voice. And then also having these hearings in Spanish for the Spanish-speaking community. Thank you.
Thank you, ma'am. Ashley, if you can go to the next person, and for the benefit of the commission, this will be the last public comment we'll take today. We've reached our 30 minutes and then additional comment at the later hearing. Ashley?
Great. Next, we're moving on to Claudia Rivera. Claudia, you now have the ability to unmute yourself.
Sí, mi nombre es Claudia Rivera. Yo soy madre de un cliente del Centro Regional de Orange County. Hoy tuvimos un meeting con el director y con su staff para exponer nuestros casos, porque se podría decir que todas las familias hispanas estamos viviendo, estamos recibiendo disparidades. Aunque tengamos coordinadoras o supervisoras bilingües, ellas igual nos niegan el servicio y seguimos sin recibir el servicio para nuestros hijos. Solo es cambiar su mentalidad y lo que este centro regional hace con nosotros. Les pido que ustedes vigilen y supervisen este centro regional, principalmente al director y a la mesa directiva, que solo manipulan y controlan la vida y necesidades inmediatas que necesitan nuestros hijos. Nosotros estamos planeando hacer audiencias. Les pido que escuchen nuestras audiencias para nosotros que tenemos muchas necesidades en Orange County. Gracias.
Thank you, ma'am. So, Mr. Vice Chairman, I think we have concluded our agenda for today. Again, for members of the public, if you have signed up for our email list, you will be notified of an additional hearing the commission will be scheduling, both to hear from Mr. Carruthers, who was to be our final witness today, and to take additional public comment. So if you were not called upon today, I apologize, but you will have an additional chance to make public comment. You can also submit public comment by email, and I assure you we will read it. Mr. Chairman, with that, I think we've completed the agenda.
Great. Thank you, everybody, for your participation. Thank you, commissioners and staff, everyone that was here, and especially for everyone that took the time to testify today. So on this important topic. So we look forward to the next hearing on this, and looking forward to completing the study. With that, I guess we're adjourned.